Hi everyone, my name's Katie and welcome to my video diaries documenting my current pregnancy and also giving you a little bit of information about certain things that you can get up to when you're pregnant and certain challenges that you'll face. So today I was supposed to be talking to you about my experience with having a C-section, but it's been quite a interesting and eventful week, so I thought I would instead talk to you about what I've got up to. So I am currently 28 weeks and 6 days pregnant, so I'm 29 weeks tomorrow. So I am feeling a little bit fed up. It's really tough. It's tough being this pregnant in your third trimester and having to work and look after a toddler full time. So I'm really feeling it now. So this is Bump. So you can see, lovely big undeniable bump there. And yeah, so what I have read or been told is that around week 27, 28 of your pregnancy, your amniotic fluid that sits around the baby tends to reduce. So all of a sudden the baby is able to, you know, oh goodness, I've got all this space. So what I'm finding is that the baby has been so much more active to the point where I actually had to phone a midwife, embarrassingly, just to check that there wasn't anything wrong with there being too much activity in there. I think what they came back to is that I reported it because it was outside of the normal baby pattern, which it was. It was going mad all the time, whether I was walking, whether I was talking, playing with my daughter, the usual times where I thought it would be rocked to sleep and there would be no movement. All of a sudden the baby was going absolutely doolally. And I was just a little bit concerned that this sudden increase in movement actually might have been significant in some way. They've just told me to monitor it. They haven't told me to get it checked or anything. There's very little out there to suggest that there's any problem with more movements. It's always talking about reduced movements in babies. So I just thought, right, okay, well, I've asked the question now, I feel better about myself, and he or she is rolling, so I'm feeling it roll, and it's when it hits the bladder that I'm really suffering, because you get this sudden or the head go against your bladder, and all of a sudden you need to leg it to the toilet to need to pee. But I wonder whether this baby has a caffeine source in there that I don't know about, because it's the most active thing I've ever experienced. So I wanted to chat to you about my consultation with the doctor based in the hospital that I'm going to give birth, because I had a planned C-section last time and I think they wanted to discuss my birth plan this time. Unfortunately, because of COVID-19, they advised me not to go into the hospital to actually speak with a consultant. So we had a telephone conversation, which on the plus side meant my husband was able to listen to the conversation as well. So we put her on the doctor on speakerphone, and we were both able to talk about it and ask questions and things like that. So that was actually really helpful. Basically, this consultation was to discuss what I would like in this birth. So what I would like, and what I've already discussed with my husband, is that I would like something called a VBAC, which is a vaginal birth after C-section. We're not going to have any more children after this. We're having two, regardless of whether it's another girl or a boy or anything like that. We're done after two. So I knew that for me it was really important to have the option to experience a natural birth. I didn't manage to have that with my daughter because it was a planned C-section. I never went into labour. I've never experienced a contraction. I got really upset with my daughter to learn that I was going to have a planned C-section. I think in my head, I had an idea that the consultant was really going to encourage me to have another planned C-section just because it would be safer and da-da-da-da-da. But actually, the doctor was really encouraging. So I came away a little bit more positive about the whole situation. I think one of the reasons why she was a little bit more supportive than normal is because the reason why I had a C-section the first time wasn't because my labour was complicated or it didn't progress. I had it because she was breech. So there was nothing to suggest that this time there would be any complications if I did have a natural birth. The only thing is that it would be like me going into labour for the very first time. So my body is going to not really know what it's doing. The one thing she did explain is that I would have to have more careful monitoring all the way through my labour. One of the risks of having a VBAC after a C-section is that it can put so much pressure on my scar that the scar from the C-section can actually rupture, which sounds horrendous, but it has been known to happen. Apparently the risk is really, really low, but this is one of the reasons why they need to monitor yourself and the baby really carefully. I was hoping to have a pool birth this time, if I could. They only have 2 birth pools available in the hospital, and there's only 1 monitor that can go in the pool. So the chances of me having a pool birth are looking pretty slim. So the other thing to be aware of is when you have a VBAC after a C-section is that you might need to be induced, especially, as I said, my body has never laboured before. I've never had labour. So my body is not going to really know what's going to go on. So I might need to be induced, especially if baby stays in there for too long. Again, it puts extra pressure on your scar. So if I need to be induced, unfortunately the drugs that they use to induce you can make your scar swell, which again increases the chances of rupturing. What they can do is put something in there called a Cook's balloon, off the top of my head. It's basically it's like a little balloon that sits there, and what it does is it opens the cervix for you and helps everything start, basically. The idea of being induced and trying to have labour which is manually done for you at the beginning doesn't sound very enticing, but my birth plan is wide open at the moment. The reason why they encourage a VBAC over another planned C-section is because, you know, a vaginal natural birth is what your body is designed to do. Having a C-section is quite serious surgery, and having another C-section on top of a previous section, actually there's going to be a lot of scar tissue there, both internally and externally, which means that the more C-sections you have, the bigger and more risks you are taking by having that. I think what I might do is ask the consultant if it's possible to have a planned C-section booked in at 41 weeks and then let my body have the chance to labour naturally up to that point. At 41 weeks, in the middle of July, I'm going to want this baby out regardless. I then had a midwife appointment the next day, and that was a bit intense because I had everything going. I had 2 lots of bloods, which she struggled to take. Then I had to have an MRSA swab. So MRSA is like a superbug. So, and it gets checked with swabs. So because I work with patients in a hospital setting, I am more at risk of having MRSA on my body, which they need to check. So I had to have a nasal swab and a groin swab, which she just gave me, and I just did it myself behind a curtain, which was fine. And the other thing I had was my anti-D injection. So at 28 weeks, if you are known to have a what's called rhesus negative blood type, so my blood type is B negative, and they found out, remarkably, isn't science amazing, that the baby is a positive blood type, which means that if our blood mixes, there's a chance that the baby could be at risk. What I have to do is have an injection just to make sure that my body doesn't produce antibodies when I give birth. So I had all those tests and things done all in one fell swoop. I talked to her about what I discussed with the consultant, and she seemed really positive about it, just like the consultant. So again, I came away feeling really positive about the sort of natural birth experience. So I thought I'd quickly share with you what happened to me 2 days ago, which was a Friday evening. And it started around 5 o'clock, and what was happening is I was starting to get what felt like initially as a sort of dull, throbbing pain in my lower abdomen. It was uncomfortable, but you know, manageable. But the thing is, when you get to this part of pregnancy and your body's doing all sorts of things, a dull ache here and there is not unusual. What was starting to happen though is that I was getting the odd shooting pain that was starting sort of on the right side of my body and shooting over to the left. So it's starting sort of in my lower abdomen, probably just below my belly button, but slightly to the right. And it was so sharp and so sudden that it would make me stop and grab hold of something and make me completely lose my breath. Like, you know, it was that kind of intense, sharp shooting pain. So I kind of took it with a pinch of salt to begin with, because I thought that maybe it was nerve pain. You know, the baby, as I mentioned before, the baby is moving all the time. So for he or she to suddenly press on a nerve seemed the most logical thing to cause that kind of pain. But I think it was the dull throb that was coming with it in between, and then the sharp shooting pain, which was lasting only about 3 to 4 seconds. It would come and go sort of erratically and not routinely. I think after about an hour of these pains coming on and off, I decided, right, enough was enough. At this point it was about 6 o'clock in the evening on a Friday, so I decided to ring the maternity unit just for advice. I explained all the symptoms on the phone to the lady who was triaging, and she said, no, we'd like you to come in, please. I was like, God. So we had to bundle my absolutely knackered by this point toddler into the car with my husband and drive the 20 minutes to our hospital, which we were going to give birth. Straight into a room. I saw a midwife. She took down all the things I was explaining, and then in stepped about less than 5 minutes later, a doctor. So that's how quick it was. It was incredible. They linked me up to a monitor, so they had like a big elastic band, and they had like 2 paddles, that's probably the best way of putting it, which they put in different areas of the bump. So she had to try and find baby, who was still moving around. Like, I'm really worried about how active this baby is, by the way. Was moving around all over the place, so she tried to find his heart or her heartbeat, and was really struggling to do so because of all the movement. But finally it settled and it was fine. The fact that it was moving around so much was a really good sign. So they weren't really worried about the baby. 3 things. I think they were worried about a urine infection, a UTI. They were worried about preterm labour. I think that was the most serious one. And they were worried that the placenta was starting to separate or rupture. Did a urine sample, which came back as negative. So they were able to do that immediately, which was great. They had to take an internal swab, which, for those of you who have had cervical cancer screening, it's like that. So that had to be sent off and checked, because that's the swab that tests for preterm labour. The final thing that they did was they took sets of bloods, another set of bloods. So that was my 3rd set of blood in 2 days. So I'm like a pincushion at the moment. And at this point the pain was easing, but the dull throb was still there. And I got the occasional sharp shooting, but it started to die down. Basically what they then did was they asked me to wait in the delivery ward, which is terrifying when you're only 28 weeks pregnant. So the doctor explained that all they would like to do is make sure that I wasn't in labour and that I didn't have any kind of inflammatory markers in my blood. The swab results came back first. They came back as negative for preterm labour, which is great. And I then had to wait around for the blood test results before they were happy for me to go. I just sat there, watched the world go by, and actually, with it being locked down, sitting in a nice dark room by myself with silence was actually lovely. It's like a mini holiday. In all seriousness though, I know I joke, but the NHS were absolutely incredible. I mean, despite there being a global pandemic and the amount of pressure there is, on our hospitals at the moment. They were able to get my blood test results back within an hour and a half. I mean, that's just insane, isn't it? Doctor came in and palpated my tummy again and just checked that I was doing okay. By that point, the shooting pain had actually stopped. It was just a dull throb. And they just said, look, everything's come back as normal. There's nothing to suggest that anything has ruptured, anything has gone wrong, the baby's moving, you're nice and healthy otherwise. All they could put it down to was maybe, as I mentioned before, a bit of nerve pain, that the baby was moving so much that what he or she was doing was just intermittently just pressing on a nerve and then like causing sharp shooting pains across my abdomen. They kind of didn't say exactly what it was, but they could rule out what it wasn't, which was all the serious stuff. And I haven't had the pain since, which is so strange. It was such a sharp, intense pain that went on for ages, and now it's as if nothing had happened, which is really strange. So that's it from me. I apologise that I've missed out on the whole C-section talk this time. I just thought all of that happened in 1 week and it was a good idea to sort of document what was happening, but I will definitely talk about my experience of having a C-section. So I will see you next time. Bye.